I first knew something was very wrong when I would walk to work. I was getting to the point where I had to stop 3 or 4 times to sit down. The lack of energy and the shortness of breath just kept getting increasingly worse. It took 4 years to get the diagnosis. My initial reaction was not good. I'm guilty of Dr. Googling. If you Google prognosis for heart failure, you would get maybe 5 years. That's not necessarily true. And that's what people need to know, that if you're getting the right treatment, if you're staying out of the hospital, there is hope out there.
A lot of patients are getting their information online, whether it's Google, TikTok, ChatGPT. So it's important to contextualize what information they may be hearing or seeing as they're reading and trying to learn more about it. When they look up statistics like the 5-year survival rate after a hospitalization for heart failure is estimated to be about 50%, that sounds really scary. Those statistics are averaged across the life course of a wide range of patients that have different reasons for their heart failure. And so it probably doesn't apply to you, but it is still a very serious disease. We want to raise awareness that there are now therapies available to help modify the disease trajectory for patients with HFpEF. Thinking about what are the things and strategies that we need to implement to make sure that we can prevent hospitalization is going to be critical.
It was hard to determine that I had a heart problem, but once I got my diagnosis, that alleviated a lot of my fears.
Every patient is different, but HFpEF does not have to ruin the rest of your life. When I describe my heart failure to someone who's not familiar with it, I would tell them, my heart isn't too weak to pump, it's too stiff to pump.
In heart failure with preserved ejection fraction, the heart muscle squeezes normally or relatively normally, as opposed to heart failure with reduced ejection fraction where it doesn't squeeze normally, but it doesn't relax normally. And it has to relax normally in order to let the blood in, to let the blood, pump out.
Your heart is not pushing enough blood out to the body quickly enough. And so things tend to back up. The first thing upstream from the heart is the lungs. And so the reason why people get shorter breath when they have heart failure is that they have more congestion, more fluid in their lungs. Their lungs get stiffer. They can't exchange oxygen as efficiently, and it's physically harder to breathe. Upstream from there, the fluid backs up and gravity will pull it down into the legs. And this is why we commonly see swollen ankles, swollen legs in patients with heart failure, is that excess fluid has to go somewhere, and gravity tends to pull it down into legs and keep it there unless we're doing things to counteract that.
If there's extra fluid in your legs, it can be bothersome, and especially if it increases to the point where it can cause problems, specifically related to skin breakdown or ulcers, and some patients may have experienced that when the swelling is uncontrolled. But more importantly, it is a sign that there's extra pressure on the heart.
You've never met a patient who wants to go back into the hospital. It's a miserable experience, and we know that patients with heart failure, it's kind of like this. Every time they go to the hospital, it's like some of them is taken away. We want to make sure that patients stay out of the hospital because it is very treatable. Only in the last 5 years did we finally start having successes, real successes of medications that work. There's so much we can do to help the patients. And so we really try to educate patients about understanding and knowing their bodies.
We have so many ways now to help our patients manage their own chronic diseases.
All of what they're doing at home is going to affect their symptoms. I think the biggest thing to stress is the monitoring. Monitoring their diet, monitoring their sodium intake, checking blood pressure, weight, swelling.
Sometimes you get that blood pressure cup on your arm and the numbers are too high. That's when you know that salt was the culprit.
I ate this, my blood pressure did this. I ate that, my blood sugar did that. If you're using these kinds of feedback mechanisms, they can actually improve their lifestyle and avoid those things that seem to cause spikes in their blood pressure.
They should be monitoring weight daily. In the mornings is the best time to check that. checking blood pressure and heart rate daily, if not twice a day. A lot of patients have evening medications, and it's helpful to know that your blood pressure prior to taking those.
What I do is I take a picture of it, and then when I'm ready to send the information over to my doctor, I just record it, transfer it onto a piece of paper, and email it to the doctor.
Those are kind of the two big things to check, but they should also kind of keep an eye on, do they have any swelling? Are they checking their legs? Are they wearing compression socks? Are they elevating their legs when they can, when they're resting, to help kind of offset that fluid? Sometimes patients think, if my legs aren't really swollen, I must not be retaining water, but it can be in other places. That's when checking weight can be helpful for patients, just to be more in tune with their body. If you have weight gain of 3 pounds in 24 hours or 5 pounds over a week, you should let us know. That's probably fluid, because you wouldn't gain weight with fat that quickly. And of course, it's so important to be taking medications as prescribed. We're going to follow you closely and see if this is helping you. And if it's, stagnant or it's getting worse, that's when we know we need to make adjustments to medications.
I think it's important to understand why they're prescribing different medications for you. And if you're not happy or you're having problems, communicate that with your doctor. Whenever I'm going to a follow-up doctor, I'll write down 5 questions. I'll bring my questions with me. And if he's not addressed during the visit, that's when I will ask the doctor, these are the concerns that I have. You have that right and responsibility to advocate for yourself.
When we check back in with them, in 6 weeks or at the next appointment, we're asking them, so now how many flights of stairs do you think you can do? How many blocks have you been able to walk? What we'd like to see is that they're increasing, they're able to do more.
A healthy diet, low salt diet, and exercise, incredibly important. That is foundation for any cardiovascular problem at any time. So we still want to emphasize all of those things in patients with HFpEF.
Being a high blood pressure patient, I'm only supposed to have 1,500 milligrams of salt per day. So I thought 1,500 milligrams of salt was a lot, but it's not. It's about a pinch like this. That's all.
Sodium restriction is one of those very difficult things. The thing that I get all the time is, well, I don't add salt to anything. Okay, that's great, but oftentimes it's the hidden sodium in the food. I would say the number one hidden sodium place that people don't recognize is breads. That's one area that we can cut down on. The other is processed food, obviously. The more we all eat at home and we cook our own meals so we know what's going into them, that's going to be really helpful.
When my husband was living, he introduced me to salt substitutes like Spike and Mrs. Dash. On my own, watching YouTube, I realized now I could use the Italian seasoning, garlic powder, onion powder. That's giving more flavor to my foods. I got a better understanding today of what's going on with me than when I was first diagnosed. I need to be, watching the salt, watching the sugar intake, and exercising.
Exercise is what limits us. It's probably the best thing for you.
Exercise training definitely works. Doesn't really matter what kind, high intensity interval, moderate intensity, it works.
Structured exercise programs can be really helpful. Trying to figure out what is a regimen that you will be able to stick with is probably the most important.
Even if you just go walking and you try to do, 30 seconds more every day or 10 seconds more every day.
My body hurts because of the arthritis all over. So it'd be hurting like hell, but I tell myself, Janice, you can do this.
Life in general, you have to learn to manage what's important to you. I can do a lot more than what I did before. Now I can take care of myself. I don't have to worry about that I'm going to pass out or, I don't have that concern anymore. I can put that focus on caring for my family.
The stiff heart, it hasn't gotten me down in life. My best advice to anybody about any type of disease they have, take each day as it comes. That's the only thing anybody can do.